Welcome to Candid Conversations with Dr. Kelly, where we dive deep into the conversations that matter most to your mind, body, and soul. I'm your host, Dr. Kelly Utenham, a passionate advocate for brain health and wellness. And here on this podcast, we explore candid conversations about life, health, and the stories that shape us. Whether it's about mental health, sports, or simply navigating everyday challenges, we keep it real, raw, and relevant. Without further ado, let's get into today's episode. Welcome to another episode of Candid Conversations with Dr. Kelly. I am very, very excited for this guest that we have today. It is the wonderful Dr. TL Duff, a physical therapist, entrepreneur, and so many other things that I can't even begin to state. So I'm going to toss it to him and let him do that. Dr. Duff, thank you so much for being on today. Welcome.
Absolutely. Thank you for having me. It's exciting to be here.
I'm glad to finally get you on. I know you have a busy schedule. For those of our listeners who don't know who you are, can you tell us a little bit about your background and what got you into physical therapy?
Absolutely. So, as you said, my name is Dr. Duff. I've been a physical therapist now for about 10 years, 10 years now. And so it was kind of an interesting road as far as how I got to physical therapy and how I got to the place that I am now. It's something that I never thought that I would do, a road that I never thought I would travel, but yet, and so here we are. So, similar to a lot of people in healthcare, I have a passion driven purpose that brought me to the place that I am now. In high school, I was an athlete. College, I was an athlete, dealt with multiple injuries and things of that nature. So I understood what it felt like to be sidelined on an injury. I know if you guys, it's athletes and they've been out for X amount of time and they're a crucial athlete and they're like, their team might be in the playoffs and this athlete gets hurt. So being on the sideline and being in that athlete's position and not being able to participate because of injury is one of the worst feelings you can get as an athlete. So I decided then and there that I wanted to not let people feel this feeling that I felt. Maya Angelou has a really good saying that people may not remember what you do to them, what you say to them, but they'll always remember how they felt. And I remember feeling so helpless that I decided then in high school in 11th grade that I wanted to do something in my career to keep people from having this feeling. And so that's a passion that's driven me through everything that I've done so far, as far as physical therapy, as far as the certifications that I've had and the education that I've gone through, the expertise and things of that nature, just to deliver a quality product to make people not feel that feeling again.
Amazing. 11th grade, that's pretty early on to know what you want to do and stick with it.
Yeah, it's funny. Even when I got into college, I declared my major first fall semester freshman year. All my friends, all my teammates, they were either undecided or changing their majors 3 or 4 times. And I saw it through. I did not change and traveled that road.
Great. Well, I thank you because, you've helped me and we'll get into that in a little bit. But you said that you were an athlete. What sports did you play?
Track and field, of course. Is there any other sport out there?
Very true. I played track and field myself. What were your events?
It was a long jump, high jump, and triple jumper.
I didn't even know that. Me too. I
Yep.
did the 1, the 2, the 4, 4x1, 4x2, but long jump, triple jump, high jump. I dabbled in pole vault for just a little bit, but that didn't last very long. But yeah, track and field. I remember those long, hot days out on the field. Goodness
Oh yeah,
gracious. Whew, so what were
indeed.
your injuries?
Freshman year of college, tore my hamstring the first meet outdoor. I've had a bunch of heel pain, a lot of nagging injuries, honestly, for jumpers. Like as a triple jumper, you need obviously both legs to be able to plan off of, jump off of, transfer energy, all of that type of thing. But just nagging injuries that have kept me from that I had to rehab through. And knowing what I know now about rehab, about sports development, about all these things, looking at some of the programs I was going through then, I was just like, I wish I could go back and rehab my body a little bit differently. But that's what we do, right? We learn from the things that worked very well, the things that didn't work very well, and we use that to create a new product in a better service line. So
I love
yeah,
that. Helps you be a better clinician, I think. Okay, so before we get into this next question, I just have a personal question. What did you do about shin splints? Because that was just the bane of my existence, especially being a jumper.
yeah. Shin splints are usually a technical problem or a biomechanical problem. Usually, shin splints happen when, like, at the beginning of the season, almost everybody goes through it at indoor, just because you go from not running a lot to doing a high volume of activity very quickly. So there's some things that you can do, but essentially, you just got to get your body accustomed to what you're doing again, so that you work a muscle when you're running and jumping that you don't work a lot when you're walking. So when you go from not running and jumping to running and jumping a lot, your body has to get accommodated to that. So it's a nagging thing for a lot of people, but it's pretty straightforward on how to address it.
Yeah, nagging, painful. I've heard it both ways. For our listeners, could you give us a definition of what shin splints are?
So shin splints, yes, it's just really it's kind of vaguely put just pain in the front of your leg, kind of in your shin area. You got your shin bone, and then you got a really soft, meaty muscle right next to it. And right between that bone and that muscle gets a lot of irritation built up. And it's not necessarily an injury. Like if somebody was poking me in my arm like this, it's not an injury. But if they do it for 3 days straight, I'm going to get irritated. So it's something like that where we just find what the irritation is and we address that. But it's a lot of nagging pain in the front of your shin, on your lower leg bone, that makes it really hard to compete.
Yes, hard to compete. I just remember getting taped up to the wazoo, which made it even harder to get my full extension. It would mess me up, and so I would have to take the tape off and just jump through the pain. But younger days, younger days. So you have ventured into the niche area of golf and kind of rehabbing people who have been injured with golf. Can you talk about how you got into that space?
Absolutely. The golf is a funny thing. Golf is the probably one of the main sports that you can play from 4 years old to 94 years old. You can play this throughout the whole plethora of your lifespan. And it's a very unique sport because it puts certain demands on your body that no other sport does. You're moving in what we call three different planes of motion: forward, backward, side to side, and twisting, all at one time. And it's very hard on the body because most people don't do that in a regular daily basis. So it's very hard on the body. But golf is probably one of the most challenging sports that exists. And coming from, I don't think it's athletic. The golf is not an athletic sport, but it's a very technical and challenging sport. That's why a lot of athletes try golf and they're not good at it. And so, me being an athlete, I thought golf was boring because it's not athletic until I tried it and saw how difficult it was. Then it was a different type of challenge. So, I started diving into it personally, just recreationally playing golf. And then I started seeing how complex it is understanding the human body and understanding how improving the way the human body works can actually improve your scores. So I mixed those together, and now here we have it now to where I specialize in golf physical therapy. And a lot of people don't even understand that that's a service line, so to speak, or an industry, but it is. And so I work with anything from recreational golfers, amateur golfers, to pro golfers who have to do 4 days worth of golf events and they have to peak each successive day. It's a lot of wear and tear on your body. So a lot of my job is making sure your body can physically do what the golf swing is requiring you to do. Okay. Once we can meet those demands, now how repeatable can we get that? Because you have swing after swing after swing, day after day, round after round. I have to build that resiliency in your body for you to be able to tolerate that. One, without injury. Two, with a very high level of skill. And three, that's a lot of people's enjoyment. So you want that result to be good.
So I want to talk about how I was injured and how you just helped me. Because,
Mhm.
yes, I did not know that there was a niche for golf rehab. If I had, I probably would have come to you much sooner. But for listeners, I did injure myself a couple of years ago. I was playing a beautiful course in Hilton Head and I was silly and did not stretch. And ironically, I was actually frustrated because the older golfers in front of me were taking their sweet time stretching, and I was actually like, would they, these old fogies, would they hurry up and get out of the way so I can tee off? And I should have been stretching as well. I did not. And I was actually rushing through the course because I was trying to make a different event to go jet skiing with the dolphins. But um, that's neither here nor there. But I ended up waking up the next morning and I had such excruciating pain. It was difficult for me to even sit up, coughing, breathing, laughing, sneezing. It was all severely painful. And I learned through Google that it was an intercostal muscle strain. And then a year and a half or so later, I ended up meeting you, Dr. Duff, and you were able to help me with some exercises and stretches. So, how often do you see intercostal muscle strain, and how do you rehab that back?
What happens, the scenario that happened with you happens to a lot of golfers to injure themselves. Now, that injury is going to manifest in different areas of the body, the shoulder, the back, the neck. By far, the most common golf injury is back pain. And the reasons are all the same because people go from majority of us in a sitting or sedentary job, even if your job isn't necessarily sitting all the time on virtual meetings and things of that nature. More than likely, you're not doing the things that require for a golf swing. You're not rotating your body, bending forward, and moving side to side. And you're not doing that all at one time. So to go from, again, just like the shin splint analogy, to go from not doing that, no proper warm up, not preparing your body, to trying to do that and trying to do that in a rush on the golf course is what gets a lot of people into injury. So what I say is this: when you see, what's your favorite sport to watch?
Mm, football
Football. Okay.
and or
So
tennis. Sorry.
all right. So let's go for football. Because everybody can understand what the Super Bowl is. Biggest game in football ever. Do you think those people get up from an office job, go out onto the field, and they start playing football?
Absolutely
No.
not.
They're spending time preparing their body, preparing their muscles, preparing everything, moving in the same way they do on the football field so that when they get onto the football field, they're ready for it. Golfers, especially recreational golfers, just amateur golfers, if you're not a pro, you're not necessarily spending time preparing your body for what's going to happen on the golf course. But yet and still, we think we can just go out there, swing that club, and have no consequences and no repercussions behind it. This is what I'll say, and I was thinking about this after we played our round on Monday. After you finish golf, you should not be in pain. But people kind of expect to be sore. My shoulder's going to be sore. My back is going to be sore, things of that nature. But it's because they haven't done the preparation work to get themselves out there. Now, if we were going to go for a 2 mile run, I highly doubt you would just get up from your chair after recording this podcast, lace up your shoes, and go out there and start running.
No.
You would prepare for it. You would warm up, you would stretch, you would jog a little bit first, you would make sure your body's ready. But we don't do that same thing on the golf course, and that leads to a lot of injury.
I think, well, one, you make an excellent point, and I think that because it's not quote unquote athletic, I think a lot of people have the like, how hard could it be mentality, and they get out there and a lot of times I see people kind of taking a baseball approach to it, where they're just like swinging away, whacking away, and however they can get contact with a ball, and they're like, I'm golfing. But you're correct; it is a very technical sport, which takes a lot of skill. But I did not have any pain afterwards. I got stretches in, and then
Yeah.
I stretched afterwards. And from your guidance, I used the muscle gun on my back and my glutes, and went ahead and did the legs and arms as well, and shoulders. And I feel great. I'm ready to play another round, but I also want to, preserve this good feeling for Monday when we play on the tournament, which you invited me to. So thank you for that.
So the interesting thing with you, and one point that I want to make, that with you, it's just all about regaining confidence because you had an injury during a specific movement, and then from then on, your body is very good at remembering what happened. Your body is saying, I don't want to do this movement or this activity anymore because last time I did it, disaster struck. And I remember how painful that was. I couldn't breathe, I couldn't cough, I couldn't laugh, I couldn't sneeze, I couldn't do any of those things. And I don't want to experience that anymore. So your body just puts a blanket statement over that whole activity and takes it away. But you really love golf. Golf is fun. You're outside, you're outdoors. Golf is just it's a particular sport. If you haven't experienced it, you have to experience it to understand what I'm talking about. And so your body just made a blanket generalization that no, we can't do this anymore. And so getting you out there, half the battle for getting you out on Monday, well, the primary goal was just to regain your confidence. Have you do something that you were afraid to do and see that the result was perfectly normal. Once you do that, then it resets your body's expectations of what this activity is going to lead to. And so now that activity led to joy, a fun time, a good time. So now your body's able to relax, and now you can swing and move the way that you need to as a golfer. So my job is twofold. One is that just increasing somebody's confidence that yes, you can do this. It doesn't have to hurt. You don't have to be sore afterwards. A lot of golfers keep Advil and Excedrin and ibuprofen in their golf bag. Like they literally keep anti-inflammatory pain pills, BC powder in their golf bag. That's not normal. You don't have to do that. You don't have to be up all night tossing and turning because you played around a golf. You don't have to pay for this or suffer after that activity. It can be completely normal and you can walk off the course and feeling good like you can do this again. So that's one thing, just getting people confident in that, oh, this doesn't have to hurt. There doesn't have to be a consequence after this. It's not a give and take with that. The second thing I do is just make sure people's body can move the way that a golfer needs to move. Because the golf swing, nobody, if I hand somebody a golf club and has never played golf before, nobody's going to immediately know what to do because it's foreign. Keep your head down, bend just a little bit over the ball. Don't move your legs that much. Twist your hips, twist your body, and hit this ball. Like nobody's going to naturally put that together. If I give you a soccer ball and tell you to kick it, you can figure that out. If I give you a ball and I tell you to throw it, you can figure that out. It's not that technical. But golf is so technical. A lot of people, I have to make sure, are your hips working the right way? Are they opening up? Do you have rotation in both limits? Can you keep your lower body still while your upper body is moving? Can you keep your upper body still while your lower body is moving? Does your shoulder rotate back? Do you have the neck range of motion? All of those things, because a lot of golfers are asking their body to do something that it can't do. And so they're watching all these YouTube videos, all these Instagram videos of how to change your swing, how to hit further, how to stop it from slicing, how to get this type of result. But their body physically can't do this. You're watching pros who are taking the time to loosen up, taking the time to stretch, taking the time to do the mobility work, so their body can move that way because they do it all the time. And they're teaching you, the average golfer who sits in a chair where their hips can't move all day, to do the same thing. So first thing I have to do is make sure your body can move the right way. That's it.
I love that there is a mental component to what you do as well. There definitely is in speech where you have to build that confidence. So I completely understand what you're saying. But that is phenomenal because yes, I did have a resetting and now I'm like back and ready to like go play as many rounds as I can. But I want you to speak to, and this could probably help a lot of people, one who don't play golf, and then a lot of wives of husbands who are obsessed with golf. Could you explain the addiction? Why is golf so addicting?
I can explain it from a competitor standpoint and a lot of male. So I guess it's a male standpoint as well, just because I'm a male, I can speak from my standpoint. Golf is so challenging. Men and competitors, so I'm sure females fall into this group as well. We love a challenge. So we love a challenge because golf is one of those things for the average person. You're going to hit 95 to 100 bad shots every round. You're going to hit horrible shots. The average golfer is not good at golf. You're going to hit that one shot that's going to bring you back. You're going to hit that one shot that's just pure gold. And you're going to be like, see, I can be a pro golfer. And it's going to bring you back because you want to experience that feeling over and over and over again. On top of the fact that you're outside. You're in nature. Most golf courses are beautiful. There's a lot of greenery around and stuff like that. You're with friends, or you would think friends. You're with up to four other people for up to 4 hours. So now you get to communicate with people. You get to talk to people. You get to learn about people. It's a quality time aspect. You're in the sunlight, so you're getting sun on you. You're getting vitamin D, so your mood is increasing. All of these things are happening, and you're spending an enormous amount of money, and you don't even care. So it's kind of a breakaway. It's kind of a getaway. It's a mental challenge. It just checks so many boxes, and people love to do that. Life is too stressful. Life in general in our society is very stressful. So people are walking around with a high level of stress. And so for a lot of people, this is an outlet where you can take that stress down. You can reduce that stress. You can give yourself mental capacity again. And so if the injury is keeping you away from that, and now you don't have an outlet because you can't play golf, now there's a bigger problem at play here, because now this is spilling over into your general life and your health and your mental well-being as a whole, because your outlet has now been taken away from you from a physical issue. So now instead of a negative, a positive stressor, a de-stressor, you have another thing to stress you out because it's an injury, your body's not working, and you've just taken away a positive thing in your life. So getting people back to golf is a huge thing. It's a huge thing. And, just seeing the reaction that you had on Monday when you were able to hit some good shots, you were able to get out there and you're able to finish without pain. That is why I do my job.
Here's a quick break with a quick question. Have you joined my Patreon family yet? It's the best way to support the show and get even more of the real, unfiltered content you love. There are 3 tiers. The free tier has previews and short clips so you know what's coming up. The $2 tier gives you behind-the-scenes content, travel vlogs, and me getting real on some taboo topics. And the $5 tier gives you full bonus episodes of Kandid Konversations with Dr. Kelly that you won't find anywhere else. We've already got hours of content waiting for you, and trust me, we have a lot of fun over there. So don't wait. Head over to Patreon and join us today. Okay, let's get back to the episode. Well, I'm so glad that you do. I feel like I'm chasing the tink. Like if you play golf, you know that perfect sound when the club hits the ball and it's like, that's the sound that I'm going for. And when you hit it, there's just nothing like it. So it's talking about being taken out of the game, out of your sport. Last year, you were very kind enough to let me shadow you on the sideline of a high school football game because something else that you do is you are the PT doc that's on the sidelines of, is it only CMS Sports, Charlotte Mecklenburg Schools?
Yeah, certain schools that we cover.
Okay, so you are on the sidelines and you're doing your thing and helping with any of the football players that get injured. I was there, of course, to check out what was happening with concussions and concussion safety and protocol and what happens. Could you speak to your experience with that and what you do on the sidelines?
Yep. So I'll go down. I guess that would be a perfect chance for me to run down the certification list. For those people out there that love to see certifications, they love to hear what is my expertise and how's my official expertise. Okay. So I have my undergraduate was in exercise science, of course. So then you go and you get your doctorate in physical therapy. So I have a doctorate in physical therapy degree. I'm board certified in orthopedics and physical therapy. So basically what that means is I go through a year-long residency to specialize in orthopedics. You take a long 6-hour test, you pass that test, you get certified with that. So I got board certified in orthopedics. Tying into sports, I have a strength and conditioning certification with the National Strength and Conditioning Association. I have an emergency response for athletes certification, which is what helps me cover sidelines and active events. I have a golf certification with the Titleist Performance Institute. What else? I have a dry needling certification with mild pain seminar. So all these certifications, I say that to say that all 5 of my credentials, so to speak, if you look at my signature, all the letters behind my name, all 5 of those credentials are specifically and uniquely designed by me. You get to choose your credentials. I chose all those to get me better at providing everything that an athlete needs. So that can span from the sideline on initial injury all the way to recovery, return to sport. So if I see you after surgery, if you had to have surgery, after surgery, if you have shin splint, something like that, golf, something like that. So all these different things just give me a perspective to be able to train somebody, whether they need strength and conditioning, they need loading, whether they need acute care management, all these different type of things. So one of the roles that I've had for the last couple of years is being on the sideline with the athletic trainer, the sports physician, which is usually orthopedic surgeon, and the paramedic. So usually that's what makes up the team: physical therapy, orthopedic surgeon, the athletic trainer, and paramedic. Okay, so we're on the sideline watching games and pretty much there for help in any injury that can happen. That injury could be somebody gets knocked out, they get concussed. That injury could be somebody broke their leg or broke a bone in their body. That injury could be a cramp, like just a traditional cramp. So we're just there for management. So yes, we were there on a particular day, and as the game would have it, there were a couple of injuries that we were able to see, one being in a concussion. So it's one kid, and to save confidentiality, I'm not going to name the school, I'm not going to name the teams or anything like that. But we are on the sideline, on our sideline, and the visitor sideline was on that side. So the play came directly in front of us, and this wide receiver got hit, and you can immediately tell. You can immediately tell through his helmet, looking at his eyes, that immediately this guy was concussed. So we took him off the game, took him off the sideline, and yeah, we started some treatment for him right there, or some assessment for him right there.
So yes, his eyes were rolling around in his head. And when he stood up, there was a coach who was right there and kind of caught him because he stood and then his knees gave out. And then he started walking towards the goalpost. And I do remember that one of the first things he said was he was okay and that he could go back into the game. Could you walk us through that cognitive assessment, or what the assessment is for physical therapy? Because you also had him do balance. You did have some memory in there. Can you walk us through that assessment?
Yeah, there was no way we were going to let him get back into the game. It just wasn't going to happen. It just wasn't safe. One thing that I don't play about are concussions, head injuries, neck injuries, and things of that nature. You get a lot of pressure from the parents, from the coaches, and from the athlete to get back in the game. And this one athlete was actually pretty upset that he wasn't able to go back in the game, which is understandable. You just kind of got to be prepared for all those factors. And as a provider, you have to just stand on your decision making to not let them go back in the game. But typically, there are two types of assessments that can happen on the sideline. And these assessments are usually done by the athletic trainer. But since I'm trained in emergency response, I'm also qualified to do that assessment. So my assessment looks like two different things. We do a memory component. So how well can you remember things? Initially, we'll just ask you simple questions like, hey, what day is today? What quarter is it in the game? What is the score? What play just happened? Who has the ball? Who has possession of the ball? Just to kind of see their orientation. Do they know what's going on right now? If that works, and all the tests are kind of progressive. You start easy. If they don't pass that easy test, they're out of there. You're not going back in the game. If they pass easy, we get harder and harder and harder and harder just to see how their body and how their brain is functioning. So if they pass that, then I ask them 5 questions to remember. So now we're testing their short-term memory. Because in the area of your brain, short-term memory and long-term memory are in 2 different positions. They're 2 different spots. I can remember my 3rd grade teacher, but I might not remember somebody's name that I just met 5 minutes ago, okay? Because they're in 2 different areas of the brain. So then we test their short-term memory. Now for me, I have 5 words that I always use. I always use the same 5 words. Because when I first started, I would come up with words, and then I want to remember the words myself. So pro tip, use the same 5 words. So I ask them those 5 words. They repeat it back to me, okay? Make sure they got it. I might do this 2 or 3 times, so I make sure they got it. And then I'm going to distract them. I'm going to test something else. I'm going to look at their balance as well, because their balance has to be really good. For an athlete, your balance is key. If your balance is off, then you're way more likely to get injured. Okay. So now this is a future risk for injury. So I'll do some balance testing and then I'll come back and I'll ask them those 5 words. If they don't get all 5 of those words, they're out of there. Okay. If they do get all 5 of those words, okay, now we'll to the next thing. Say their balance is good, they got all 5 of those words. Now let's get your heart rate elevated a little bit because now we're getting blood flowing throughout the body, we're getting blood flowing to the brain. If that gives you any dizziness, any symptoms, you're out of there. Now that you're running back and forth, I'm going to redo all the same tests that I just did with you. Now that your heart is beating faster and that your circulation is beating faster. If you fail any of those tests, you're out of there. If you pass all of those tests and there's no other things that I see that are preventing you from going back in the game, then you're clear to go back in the game. But in this particular athlete, he actually did really good on the memory test. His balance was not good, but he did really good on the memory test, like surprisingly good on the memory. He knew the score, he knew the play that he ran, he knew everything that was happening. So his awareness was there. But me seeing that injury, I knew he was concussed. And then so in that case, I have to find some data to prove that. So I just started going and challenging him a little bit more. When he started balance, his balance was completely off. You can't necessarily, it's hard sometimes to go by symptoms because students and athletes can lie about their symptoms if they don't understand the severity of things. And usually they're just focused and want to get back in the game. So they're like, I'm fine, I'm fine, I'm fine, I'm fine, I'm fine. So it's hard to go by symptoms that day. And a lot of times there's delayed symptoms. You might not feel your symptoms till the next morning when you wake up. But the risk for sending somebody back in the game if they have a concussion, we've all seen Tua Tagovailoa last couple of years with his injuries, the quarterback for Miami Dolphins. Sending somebody back in the game if they're already in a concussion state, if they get a second injury to that head or a second blow to that head, they're way more likely to have lasting and major issues and problems and impairments than if we took the time to take them back and let their brains heal up.
Absolutely. And was this particular player, he had just come off of concussion protocol, right?
He had a concussion in the past, but it was a couple of years ago. It was about 2 years ago.
Okay, okay. There was another player who was recently coming off of the list. I confused the two. Okay. So can you talk about what being trained in concussion or your education in concussion has looked like for physical therapy? Because as a speech therapist, I'm kind of trying to find an avenue or a path into the sports realm for it. And when I show up on sidelines, physical therapists, athletic trainers, the orthodox that are on the sidelines, they're like, what are you doing here? Why would I send a patient to you? What does speech therapy do? So could you speak about your training in concussion and if speech therapy, like the education or knowledge that speech therapists are a part of that cognitive rehab team as well, if that's there?
Yeah. So when I first started treating concussion, every physical therapist does not treat concussion. Concussion is definitely a niche in its own within the PT realm. When I started treating it, I was back in Virginia. This was early, probably year 1 or 2 of my career, where I actually helped develop a concussion protocol, really pipeline, because patients with concussion are a large patient demographic that just kind of falls through the holes because management isn't streamlined for them. So they don't really get the medical care they need. So we tried to solve that by developing a pipeline from neurologists, neurosurgeons, conservative care, PT, allied health, all that type of thing to be able to get these people the care that they need. So I was involved in that early on in my career, and then it just kind of progressed by taking continuing education courses from there. Currently, then when I moved to Charlotte, I was part of a concussion team of PTs, OTs, and speech pathologists. The role that fit, and we all have a slightly different role in concussion management. And to be clear, there's a difference between concussion and post-concussive syndrome. A concussion is the initial injury that happens. PTs, we don't typically treat concussions. Now, what happens is if after that first 2 weeks, if that concussion doesn't resolve on its own, now we're into what's called post-concussive syndrome. And that's just where the symptoms of concussion are lasting longer than 2 weeks. The body's not able to heal itself up as quickly as it needs to. What that looks like is difficulty tolerating light, difficulty tolerating loud noises, um, queasiness, vomiting, nausea, difficulty concentrating, difficulty reading, can't sleep. If you just imagine what it feels like to have a hangover for 2 weeks, that's essentially what post-concussive syndrome could feel like. So we have a big involvement in there. Now, most of our treatments for that are what we call vestibular treatment, and that's just recalibrating everything in the inner ear. We also have to work on depth perception for athletes and for just individuals driving, right? You need to have good depth perception because concussion can throw your depth perception off. Just your ability to interact with your surroundings. So a lot of it is balance, vestibular, depth perception, and those type of things. Now, when it comes to a lot of the cognitive, recalling, not getting lost in conversation, stuff like that, those are all specialties that I defer to speech therapists because you guys are way better at it than we are. We just do the kind of the physical orientation aspect of treating concussion.
Got it. Thank you. So, could you I guess, surmise the difference between a physical therapist who specializes in vestibular PT and a physical therapist who does not? I say that because a lot of times someone could get a referral, a parent, an athlete, if they're of age to handle it on their own. And they'll say, well, I'm going to the physical therapist. And the unfortunate piece about the lack of awareness with concussion and what you need is if people have a referral and they're like, oh, great, I'm going to get in with the neurologist, or oh, great, I'm going to the physical therapist, they don't know that they need or may need a specialist like a vestibular physical therapist. And so they go to a physical therapist and like, oh, yeah, I'm getting the care that I need, but they don't even know to ask for a vestibular PT. So could you tell the difference between PT, a physical therapist, and a physical therapist who specializes in vestibular therapy?
Yeah, and that's one of the big things that we tried to solve earlier on when I was in Virginia about getting people to the right providers. It could be like, you know, anything you want. I would imagine that the provider, once they see the patient and they do their assessment, they can kind of realize that, either I'm equipped to see this patient or I'm not equipped to see this patient. And that really, in my opinion, in that case, falls on the institution that the patient is being seen, either the administrative aspect of doing the scheduling to properly schedule these people with the right providers, or on the providers on desk to be able to see like, hey, I'm seeing what you're dealing with. I'm not the most equipped to see you, but I know somebody who is. Here, let's go here. Or call this number and ask for this type of treatment because this is going to be the best for you. But there's no way for everybody to be good at everything. There's no way. So you want specialists. You want people that are really diving deep into a specific area so that you can get the best care that you need for that. But when it comes to that situation, I think the onus is on the institution, the provider, the office that they're being seen, not necessarily on the patient, because in my opinion, it's not fair to expect the patient to know what they need and where they need to go to because they're not the professional in the matter. We are. There have been plenty of times where a patient has come to me and I thought they were going to be something simple, even based on how the sheet is coded. And I get them in the office and I'm like, okay, you are somebody that I could treat, but I won't do you the most justice. Let me get you to somebody that can probably get you way more justice than I can get you as a provider. And I mean, we're healthcare, we're here to help people at the end of the day. It's not an ego driven industry. So I shouldn't be like, oh man, I need to be able to fix everybody. Everybody that comes to me, I should be able to fix the me problem. I think we should do what's best for the patient in that case and get them in front of the right person um, to be able to handle that situation.
I completely agree. And I will say you are one of the coolest PTs that I have met because, as I've told you outside of the podcast, there are some PTs that are just a little different and thinking that they do, know everything, and even have heard PTs say things like, oh, well, you don't need speech or OT, just go to a PT. They'll take care of all of it. But you are more on that interdisciplinary team and collaboration. So I'm very grateful to be connected to you. You are the coolest PT I know. Um, so you have expertise in what you developed in Virginia. So there are, what I'm trying to do through Brain Talk Foundation, the podcast, is really raise awareness because the 5 words that I hear that really just change the trajectory of my practice and what I'm doing professionally is I wish I would have known. And everybody who says that to me, I want them to have the awareness so that they don't have to say that anymore. And of course, I'm not trying to stop people from playing sports. I love sports, obviously, former athlete, lifelong sports fan. But there are gaps and there are areas of concern. And so I'm trying to get into the schools so that young people and their parents, coaches who are coaching these young people, so that they can have a better understanding of this awareness and to take concussion seriously. When you are doing your work on the sidelines or working with young people, what are some gaps or concerns that you see when it comes to the awareness of concussion?
Honestly, the gaps are the same globally. It doesn't matter which level that you're seeing people on. I've seen high school athletes, middle school athletes, high school athletes, college, semi-pro, and pro. I've seen them at every level. The awareness, the mindset, so to speak, is almost all the same. It's very easy as an athlete to think short-sighted. A lot of athletes think short-sighted. I need to get through this game. I need to get through this season. I need to get through this stage and get to the next level. Like, what do I need to do to get to the next level? It's hard to think beyond that at any type of thing because you have to be laser focused to be able to be the best that you can be. Concussion, since it is what we call the invisible injury, concussions don't show up on scans. They don't show up on MRIs. They don't show up on CT scans. They don't show up on X-rays. They don't show up on any physical to blood work or anything like that. So it's the invisible injury. So you can go to the hospital and get checked out, and all of those scans can be completely normal. And so one is left to think, okay, I'm fine. This headache should go away. These things should just go away. Everyone is when everyone is telling you that you're fine, even if you don't feel fine, you're going to assume that you are fine, that you are okay. And that's the thing in and of itself. But because it's what we call the invisible injury, it's hard. It takes a lot of education for people to take seriously and understand the severity of the situation, the potential severities of the situation. And we like to take it, since we've seen the scale that this can go from very minor, you're better in a few days, to very severe, your life has changed as a result. Since it ranges that wide, we have to err on the side of caution. We have to. And so we're a lot more conservative with these injuries than we are with a lot of other injuries, and people can get frustrated because of that. But as a provider, you have to be okay with the pushback from the coaches, the pushback from the parents, and the pushback from the athletes. I've even had pushback from other healthcare providers, but I base my assessment on what I see. I base my decision on what's best, not in the short term, but for the long term for these athletes. Because even after your sport, there's life after your sport. And if I'm not helping you prepare for that life after the sport, if I'm possibly injuring that life after the sport, then that's an issue. We need to address that by taking this concussion seriously, by taking these invisible injuries seriously.
Absolutely. And something that I absolutely think of, because that can't, I mean, it's not a fun position to be in where you have to do what's right for the patient, even though they don't want it or their parents may not want it. And I just say I'd rather have a pissed athlete than a dead athlete. And I think it's really a tough position to be in with parents and coaches.
Hey, for all of my speech therapists and other healthcare providers, let's be honest, writing soap notes can be time consuming and exhausting. But with Freed AI Scribe, documentation just got a whole lot easier. Here's how it works. Freed AI uses artificial intelligence to record your sessions and instantly generate accurate professional soap notes. That means more time to focus on your clients and less time stuck doing paperwork. Freed AI is HIPAA compliant, which made it easy to incorporate into my private practice. And it has been a game changer. It saves me time, reduces stress, and best of all, helped me finally get out of the office at a decent hour. If you're ready to simplify your documentation, use my code Dr. Kelly50 for $50 off your first month's subscription. And join me and other SLPs who've made the switch to simplify your soap notes. The link and discount code are in the show notes. Now, back to the episode.
Describe an instance, no names or anything, or just a situation where someone has pushed back, whether it be a coach, a parent, and how you handle that situation?
You gotta, all right, let me, for this one, I'm gonna take my podcast demeanor off and I'm just be me. You gotta stand on it. You gotta own it. You gotta stand on it. Like, look, you gotta be, I don't care. You can get upset. I don't really care, honestly. And a lot of the pushback is just, I need this athlete by this time. Can they make the game? Can they make the playoffs? Can they do this? Can they do this? Coach, I'll be honest with you. It's not likely. Not likely. It's a no. It's a yes. It's a maybe, but I'm not going to rush the process because you want to score on offense or you want to be unstoppable on defense. But for a lot of people, the pressure comes from this is my year to get good film so I can make it to the next level. It's the ability to make it to the next level. I want a scholarship. NIL deals are huge now and it's based off of performance. So a lot of the things that we do in society are based off your performance. So if you're injured and you're not able to perform, you're not able to gain that film, so to speak, gain that resume to be able to show your value at the next level. And that's an issue. So a lot of people are concerned about, am I going to be able to make it to the next level? I need to do this to be able to reach that. And I can understand that because that's people's livelihood that we're talking about. But if I have to compare livelihood to your life, which one are we talking about here now? Is that a conversation? And you may not fully understand that. That's fine. Athlete, a patient, a parent, a coach, staff member may not fully understand that. That's fine because this is my specialty. I understand this a little bit more in detail, and I'm fine with living that decision. At the end of the day, though, my decision is only a recommendation. So it's not law, it's a recommendation. This is my professional recommendation. I'm going to make sure it's well communicated, but I can't physically restrict you from getting on the field. I can't physically make you not do these things. I can strongly give you my recommendation. I can strongly urge it, but outside of that, the decision, the best thing I can offer you is the information. The decision is yours.
More awareness. What do you say to athletes or anyone really? I was who says that they don't believe in concussion or that concussion isn't real. I was after the game that we went to, I went to another high school football game, and there was a very large young man who was on the sidelines, and he had actually concussed two of his teammates. And those teammates were there. They had only their jerseys on and regular shorts, and each of them were wearing sunglasses. And speaking to awareness, I was there with a fellow SLP who was just interested in the space, and she said, like, oh man, like these young kids, they think they're so cool out here at nighttime with sunglasses on. And my mind, I'm thinking they're probably concussed. And so I ended up speaking with the athletic trainer there, and she said, "Yeah, like these are two of our players who just got concussed." And then she pointed to the larger young man, and she said, "And this is the kid who was in the play that concussed them during practice." And so I spoke to him, the player who concussed his teammates, and I asked, what was that like? And, they've got concussions now. Have you ever had a concussion? He said he'd been playing since he was in third grade. And he said, I don't believe in concussions. He said, yeah, you can get a headache, but you just take Advil or Tylenol or whatever's around and it goes away. And that's just what it is. So what do you say to anyone who thinks that concussions are not real?
I honestly have never personally had that experience. I've never had that conversation with somebody. But the reality of the situation is a lot, especially when it comes to specialists, what we see all the time becomes what we look for all the time. So, somebody like you is going to be hyper aware of somebody at nighttime at a game wearing sunglasses, not trying to be cool, but they're literally injured and that type of thing. Somebody like you is going to be aware that even though you're on the sideline and you have sunglasses on, the marching band is right behind you making all this noise, and that can't be good for you. To be honest with you, you don't need to be out here at all. Somebody like you is going to be aware and pick up on these things where somebody who's not in this space is going to blow past all these signs and all these cues. And that goes for any profession that we have around here. I had somebody in my clinic one time that was an IT specialist. And I'm in a kind of an industrial building, and so all the wires are exposed. And she's just pointing out all the wires and how it's, networked together and things of that nature, and how you can test where this wire goes to. And I had no idea that exists. Like, I just think it looks cool. I know I plug it in and I know it works, but she's open to that world. So that's what she looks for when she comes into a space. And the same thing with us. So as far as really trying to convince somebody that something is real, I don't necessarily need to subscribe to that, because uh, everybody's going to have their own perspective, right? And it may not be my full job to fully convince somebody, but if we have a conversation and that's a seed, and then later on you kind of get exposed to it a little bit more and more, I can expose you to the knowledge. I don't have to. It's not my responsibility to have you digest the knowledge. So I can present it to you, and then again, from there, you can decide what you want to do with the information, if you want to accept it or whether you want to reject it. That's there from you. But if I present it, and then later on you get presented more and more and more and more, then it can start being aware to you. So my response to that would just be presenting the information and kind of leaving it as there. I don't argue with people. Like, honestly, that's the real answer. I don't argue with people. You want to do what you want to do what you want to do. This is my information. Either you're going to respect me as a professional or you're not, but you're going to make up your own decision. People going to do what they want to do regardless. But I'm going to present the information and you can take it from there.
I like that. That is the premise of Brain Talk Foundation and how I am raising awareness. I'm giving you the information, and then do with it what you will. Can't force you to do anything you don't want to do. So what advice would you have for physical therapists who are interested in getting deeper into the concussion management space?
Easy, continuing education. Any physical therapy, when we come out of physical therapy school, we're all generalists. No matter how smart you think you are, you're a generalist. You don't specialize in anything. You have a degree, you're entry level, and you're a blank canvas. In order to get more knowledge in anything, you need to go and do continuing education. MedbridgeEducation.com is a really good one. They have a lot of specialties, and pretty much any specialist that you can specialize in is going to be on there. You can get exposed to that information. And I can't say enough about mentorship. Unfortunately, concussions falls under, it doesn't distinctly fall under any broad specialty as far as neurology is concerned, with PT, of course, orthopedics, any of those types of things. So you kind of have to seek it out on your own, but find an expert that's really, really good at it and learn from them. Physical therapy is all about collaboration. Despite what Dr. Kelly thinks, she thinks that all PTs are egotistical and the end all be all. That's fine.
I didn't say
that.
egotistical, but go ahead.
Okay. All right. You didn't say it, but I'll say it for your listeners. You got a following that you got to appease to. I don't. She said we're all egotistical. That's why earlier she said I'm the cool one. Rewind it back. You'll hear. She said I'm the cool one.
I didn't use that word. You are the cool one, but I did not say egotistical.
Collaborate. I mean, we're all in this together to help each other. So if you find somebody that's really good in that space, collaborate, learn from them, pick their minds, and see what they did to get to that profession. But education, collaboration, that's the things you could do.
I love it. So listen up, PTs, non-egotistical PTs. Okay, before we get into the Kandid questionnaire, how can people find you? Tell them about your practice, anything that you have coming up that you'd like to promote.
Absolutely. Find me on Instagram at Dr. Tay _ DRTAE _. There you can also find the clinic page at RIMPTCLT, RIMPTCLT. With that, so a couple of things coming up in the summertime, a lot of golf tournaments that I sponsor and vendor. So what I like to do is golf tournament. We have one coming up on Monday, May 12th, and for the James Black Foundation. I'll go over there and I'm just a vendor. I'm helping people bring awareness to what their body is not doing for themselves. So increasing their mobility, increase their stretching right before the round. So as people are checking in and they're warming up, I'm assisting in that warm up so that you can go through that round and that you can play to your best in a tournament, right? You want to play good in a tournament. So I help free you up, free your body up, make sure you're moving like a golfer so you can do that. I have a couple of tournaments throughout the summer, throughout the fall. where I will be at. If you're interested, if you're hosting the tournament and you're interested in having somebody like me out there, definitely reach out to me on Instagram and we can connect. And I would love to be able to partner with that. Because when it comes to golf, when it comes to physical therapy, I can talk all day and night about it. So I will love to be in that space. But outside of that, you can catch me at a golf course near you, hitting birdies and pars all throughout the day.
Yes, birdies and pars. Well, I'm definitely going to, well, I will be there on Monday. I'll be playing thanks to you. And I'll be out there. I want to see what it is that you're doing with the warm up. I've seen some of your videos, and there's this motion that you do with someone's leg where they're sitting on the edge of your table and you're moving it almost like a pendulum. And to
Mm-hmm.
me, not aware, I'm like, oh, look, he's swinging their leg back and forth. So I want to know like what it is that you're doing and what the purpose of that is. I'm like a sponge. I'm very interested in all aspects of allied health. So I'll be there asking plenty of questions. Hopefully you'll be available to answer.
For sure.
Okay, so now we're going to get into the Candid questionnaire. These are 5 fun questions that I like my guests to answer so that listeners get to know you a little bit better. Are you
I
ready?
will be honest. I will be honest. I have no idea what these questions are, and there's no telling what I say. So if I pause, I'm trying not to say the first thing that comes to my mind because usually there's no telling what I'm going to say.
I want you to
So,
say the first thing that comes to your mind, but I think you're going to be
all
good.
right,
Okay.
okay,
All right. First question. What's one word your friends would use to describe you?
crazy, crazy. That boy crazy. Goodness gracious, that boy crazy. That boy crazy. You crazy. This guy's crazy. Crazy. Crazy.
I would venture to say funny, but maybe that's in that same realm because you're funny and you don't mean to be.
Yep. Yep.
Okay, number 2. If you could instantly master any sport or physical skill, what would it be and why? He's thinking.
Ooh. Instantly master. So now I have to go through all the things that I'm already not good at. That's probably the hardest part, figuring out what I'm not good at because I've mastered almost.
There's that
Uh,
PT.
Now to keep it real with you, probably golf. And I'm not just saying that because of golf. That's the biggest challenge, and it's so hard to master. Like, when do you ever master golf? I think that's what people I think that's when people fall into that trap. Like, when do you ever master it? Like, you'd be really good, but how do you win? How do you beat the game? I don't know. Golf. Yeah, I'll say golf. Because golf is a really big egotistical sport. And that's what gets a lot of you guys injured too, because you're ego driven. You know you can't do what you're trying to do, but other people are doing it around you. So you're trying to overdo that. So stop doing that. But yes, I would say golf.
Yeah, listen to your bodies, people. Okay, number 3. What's one activity or hobby you find most relaxing or beneficial for your brain?
Honestly, hanging out with friends. Just community. I realize that community and being around my circle, my village, my tribe, so to speak, is the best thing. And it could be just hanging out at the house. It could be going somewhere, anything. Just being in the presence of the people that I value most. That is by far the most fulfilling for me.
I love that answer. Okay, number 4. What's the weirdest or most unexpected item in your bag or car right now?
I mean, unexpected, weirdest.
Weird or unexpected?
I don't think anything I do is weird. So that's a hard question. I don't think anything I
Okay,
do is weird.
go
Oh no,
unexpected.
I got it. Bowling pins. I got
Bowling?
two. I got Yeah, I got two bowling pins in my trunk.
Why?
I got two bowling pins in my trunk because I picked them up last time we were at the gun range with the rifle range. If you get bowling pins, you can shoot them all day and night, and they're just reusable. So they're reusable targets. So you can shoot at them and shoot at them and shoot at them. The bullets go straight through them, or they're almost out. So yeah, you can use those all day and night. So I got two bowling pins in my trunk, and I try to put them in a place where they're not rolling around every time I turn and stuff like that. But yeah, I got two bowling pins in my trunk.
That's
So that
interesting.
is, yeah.
How do you get, so I do go to the range as well, but how do you get the pins out there? That seems dangerous, no?
It depends on where you go to. Yes, but I go to outdoor ranges where it's a ceasefire. You go out, you set them up. The range guy actually goes out there and puts them in places, and then we shoot at them, and then they bring them back.
Okay, I've got to. Okay, will you take me? I want to go to an outdoor range. I've always gone to indoor ranges.
Yeah, you gotta go outdoors, shoot some bowling pins, and then you have them in your trunk.
Yeah. And then you can answer what's the most unexpected thing in your car. Okay. Last question. What's your go-to guilty pleasure TV show, movie, or song?
It's not really a guilty pleasure, but I like kids movies like Moana 2. Like I was stressed the other day, and I watched Moana 2. Or I watch Sing 2. Like Sing 2, that's my movie. Like I'll watch Sing 2. Like my daughter doesn't even like Sing 2, but I'll watch it. And I know all the scenes, I know all the songs and all those type of things. But yeah, animated stuff. And I'll tell you why. I'll tell you why. There's a why behind everything. This is why I don't think I'm weird. There's a why behind everything. When I was in school, when I was in grad school, the curriculum is just so intense that I needed to find something where I can just be a kid again or like not have to think, right? Just turn my brain off and just find that enjoyment. So it started with cartoons. I would watch different cartoons and series and movies and stuff like that. And then it just developed as a downtime activity where I can just watch something where I don't, because a lot of shows you got to think through, right? You got to either figure out the thriller or figure out who killed who, so and so, or Will Smith movies are so convoluted. You got to be like, oh, I didn't even notice that. So if I could just watch an animated movie where I can just chill and be entertained, that's my form of entertainment. So that's where that started, and that's why I do that.
I like that. I do the same. So at the not kids movies, but I call it, watching mindless dribble. So I will watch, something reality where you don't have to really think. So the Kardashians, that's a big one. You definitely don't have to think watching that. But also where I don't have to analyze because a lot of my stuff is analyzing people's cognition, how they, handle things, or they're remembering things, what's going on with their word finding, sequencing, problem solving, safety, all the things. And when I watch something, and it could be, watching a podcast on YouTube or something like that, it's just I don't have to think, and that is a nice rest and reset for my brain. So I totally get
For
where you're
sure.
coming from there. Well, Dr. Duff, thank you so much for being on today. This was very enlightening. I am looking forward to playing way more golf thanks to you, and interested in this outdoor range thing. So thank you. You're always putting me on to something new.
Absolutely. Absolutely. Thank you. It was a pleasure. Everybody, to all the listeners, keep listening in. If you haven't liked and subscribed to the podcast yet, do that. What are you waiting for? Do that. We just talked about awareness. You need to be aware of this podcast. It needs to be on your rotation on a regular basis. So definitely tap in with her. Anything that she's doing with the foundation, anything that she's doing, just support it because there is a world of information inside this young lady. So definitely do that.
You heard it here. Doctor's orders. Thank you so much, Dr. Duff. We'll talk soon.
Absolutely.
Thank you so much for tuning in to this episode of Candid Conversations with Dr. Kelly. I appreciate you being part of this journey and these powerful conversations around brain health and beyond. If you're loving the podcast and want even more bonus episodes, exclusive Q&As, stories from my professional and personal life, behind the scenes moments, and yes, those bloopers you all love, then I invite you to join my Patreon family, where we always keep it candid. Your membership gives you access to all that bonus content and helps keep this podcast going strong. Plus, every contribution helps support our mission to raise awareness, educate, and empower others about the silent struggles so many face. So head on over to patreon.com/Dr. Kelly to join today. I'd love to have you. Until next time, stay curious, stay compassionate, and as always, keep it candid.